As a parent, there's nothing more heart-wrenching than watching your child struggle with chronic health issues despite trying every recommended traditional medical approach, and then going fully down the road of natural and holistic health remedies. You've been to countless doctors and specialists, filled numerous prescriptions, and explored various holistic and biomedical therapies, diet changes, detoxes, cleanses, vitamins, supplements, herbs, infrared saunas, and so forth. But nothing seems to work. The frustration and helplessness can be overwhelming, leaving you questioning if there's something missing, or is my child just stuck this way? But what if the real key to unlocking optimal potential and healing for your child is doing all the things, but in a different order or sequence? What if it's as simple as breaking things down into a more specific sequence or batting order that aligns with the exact pathway of stress and dysfunction that causes them to get sick in the first place? You've been there. Don't worry, we've got you. Give us a like or share if you or a loved one has experienced this as well. Because today we're going to discover why the sequence of healing matters more than the individual therapies themselves, and how addressing nervous system dysfunction first through neurologically focused chiropractic care can finally unlock the results you've been searching for from everything else you're already doing. Here's what's absolutely fascinating about the shift we've seen in healthcare over the past 15 years. In the early stages of practice, 80% of our patients were already medicated before learning about neurologically focused chiropractic care. And 20% of them knew anything about gluten, dairy, vitamins, supplements, and drug-free approaches. Today that has completely flipped. 20% of our patients are taking medications, and 80% of them have already gone deep down the roads of natural health and drug-free healing. But here's the concerning reality. Chronic disease prevalence has risen to nearly 30% in the last 20 years. And our average new patient today has more illnesses and various health struggles, which reveals a critical gap that most parents and even healthcare providers are missing entirely. And that missing link is understanding how the nervous system works and how it truly heals. You see, the nervous system develops first in utero, acting as the air traffic controller for your child's body by coordinating vital systems like gut health, immune function, motor skills, and brain functions. Dr. Bruce Lipton, a cellular biologist and researcher, explains that the function of the nervous system is to perceive the environment and coordinate the behavior of all other cells, which is why the neural tube is one of the very first things to develop during pregnancy. When the nervous system gets derailed and off track developmentally due to early life stressors, everything downstream gets thrown off as well. We view this in our office through what we call the triangle of neurological healing. So we're going to jump on over to the iPad here, because what we see in this triangle is exactly how healing really takes place. We have to start at the base, and the base, by all means, is the nervous system. As we just mentioned, the nervous system is the first thing to develop in utero, or one of the first things. And so if it is one of the first things to develop, it should be one of the first things that we want to take care of. Because when our nervous system works properly, then it's going to allow for the neuromuscular system to work properly. So all the different muscles, from the ones that we move on our own to the ones that move without us even thinking about it, which then allows for the neurogut to work better. So all the digestion, elimination, and absorption works better, because we have a properly functioning nervous system, which then allows for the best brain development possible. In this sequence, healing happens well, right? But we need to do it in the correct order, because what we see in our society today is, more often than not, we may have someone who struggles with a muscular issue. And so they will do everything they can to try and rehab the muscular issue, and they'll hit plateaus. They'll get frustrated because the things that they're seeing, the progress they're seeing, stops. And then from there, it might be, oh, well, our muscular problem is related to a gut problem, right? So then they'll go and they'll try all the detoxes, diet changes, herbs, remedies, all the different things to get the gut working better. And again, they'll get so far and see a plateau. Oh, well, then maybe it's a brain issue, right? So maybe we've got some roadblocks up in the brain that we need to fix along the way. And again, those plateaus come and frustrations happen. And then at the very end, they come back down here, right, to the nervous system last. They walk through our door. They look at us. They say, I've tried this, that, and the other. I've tried everything, but nothing seems to be really getting us over that healing hump. And that is because they've gone out of order with the healing. And it's because of seeing this happen with the nervous system not being considered that this is why nearly every child is struggling with chronic neurodevelopmental conditions, but they also struggle with digestive problems, weakened immune responses, motor challenges, and sensory processing difficulties. You see, there are 3 sequential steps of optimal neurodevelopment. The first step is the nervous system foundation. Without proper nervous system regulation and function being activated and optimized first, everything else is limited in what it can do and the results you should expect. Step 2 is the motor system, because movement truly is life. And every childhood development expert knows that motor development is key to brain and nervous system development overall. But muscles can't move themselves. The nervous system must function properly first for the motor coordination to develop properly. And step 3 is gut and immune health, which, while absolutely essential, is controlled first and foremost by the nervous system through the vagus nerve and brain-gut connection, which means the brain-gut connection comes before the gut-brain connection. So then why is this batting order or this sequence of healing matter so much? Because each individual form of natural, holistic, integrative care is amazing and does its job. But when we address nervous system dysfunction first, we unlock something within your child's brain and body that makes every single other therapy work exponentially better. This is why so many parents report that their children finally start seeing massive gains in PT, OT, and speech therapy once they begin getting adjusted. Because we're addressing the foundational neurological dysfunction that was limiting all other therapies from achieving optimal results. Because what we're doing is we're reopening neurosensory pathways that were once closed due to subluxation, but now are open through neuro-focused care, allowing proper development to be achieved. Think of it like trying to restore and rebuild a home that sits on a cracked, crooked foundation. No general contractor would spend hundreds of thousands of dollars remodeling without first repairing and restoring the foundation until it's stable and solid. So if you feel your child is at a stuck point after trying every single route of healing, from the traditional medical route to the holistic alternatives, or maybe has been hitting a plateau in their therapies and nothing seems to stick or work, it's time to start addressing first the foundation of how our bodies heal through the nervous system. To learn more about the nervous system and its continual role in our children's health and development, and how neurologically focused care can help, click the link in our bio to learn more.